Hi, welcome to the start of a new series on Botox and Burpees where we talk to surgeons. It's really a unique perspective. Surgeons bring a lot of different skill sets as well as perspectives to the table, and not all surgeons are the same. There are certain things that are very unique to surgeons, but surgeons also have a lot of variety, not only in terms of their specialties, their procedures, but also just what makes them tick or why they operate. And so I couldn't think of a better person to start off this series than my friend, Dr. Kathleen Van Leeuwen, who is a pediatric surgeon out of Phoenix, Arizona. Our lives paralleled in many ways while we started training. We both went to Columbia Medical School and we were both at University of Michigan. She was a general surgery resident. I was a plastic surgery resident. When you're in training and there are certain people that just really stand out, they're superstars. She was definitely one of those. And my first experience with Kathy, and we talk about it a little bit in this podcast episode, is when I started on the trauma burn service. So I had a little bit of a atypical start to my residency. I did 3 years of general surgery at Columbia, and then I went and finished my plastic surgery residency at University of Michigan. Kathy had already been at University of Michigan as a general surgery resident for several years, and I spent 2 years in the lab before I went back and started my clinical training. And taking 2 years off and then coming to a new institution and starting to work in a hospital again was a very rough transition, and it would be for anybody. And I started with Kathy as well as another resident, Jonathan Haft, and they were probably the 2 best people I could have ever imagined to have started working with back in the hospital. The trauma burn unit is one of the busiest units at the hospital. It's a level 1 trauma center. They cover burn throughout the entire area. And Kathy was a superstar. She was a team builder. She was upbeat in a time when it was really a difficult and it was really a hard place to work. And they made my transition awesome. They made me feel competent in a time when I felt like I was in over my head for sure. And Kathy has gone on to do great things as the associate surgeon in chief at Phoenix Children's in East Valley. And you can hear her when she talks in this episode about all of the team building that she's done over the years, how she's leveraged her abilities as a surgeon. And trust me, she is a superlative surgeon. I saw it firsthand. That's just a prerequisite for being a great surgeon. But it wasn't just her surgical skills that allowed her to become successful in her career. You can hear all of the other things that she built and the people that she worked with and the skill sets that she either intrinsically had or developed over time. And I think the way she has navigated being a woman in a very male-dominated field, you can see where she's worked to overcome a lot of obstacles. And I think she took a really practical approach to get things done. And I think for anyone thinking about how do I become successful in whatever field, I would say the skill sets that Kathy has developed over time are intrinsic to whatever business you might be part of. It really blew me away how successful she's become, how she's approached that success. And now, as a senior surgeon, what her plans are now and in the future. And I really hope you enjoy this interview because I really enjoy talking to her. So let's get right to Dr. Kathleen Van Leeuwen, pediatric surgeon. Thank you. All right, welcome. I have for my first guest on this surgical series an old colleague of mine. We go back way back since like medical school, even actually.
Yeah.
Dr. Kathleen Van Leeuwen. She is a pediatric surgeon for over 20 years, which blows my mind how long we've been sort of in the business, I suppose.
Yep, that's
Um,
right.
yeah. So Dr. Van Leeuwen went to University of Southern California for her undergraduate training, where you actually got a BA in English. I did not know that. That's great.
Mhm.
And then Kathleen and I were both at Columbia College of Physicians and Surgeons, now called Columbia Vagelos College of Columbia University Vagelos College of Physicians and Surgeons, and we graduated from medical school there. And then we actually also crossed paths again. You were a general surgery resident at University of Michigan, where you were also the chief resident. And then after that, you did your pediatric surgery fellowship at Mott at the University of Michigan, and you stayed. And then after that, you joined. You went out to Phoenix, right? And
Yeah.
you've been there for like 20 some years at this point.
Yeah, it's close to 20 years, came out in 2005, and
Hmm.
I really enjoyed being in Phoenix. I mean, first of all, it's great to talk to you, Sam. I'm so excited to that you're, looking at insights that surgeons have. We're a very unique population of doctors, right? Because surgeons are leaders. People look to us to lead. People look to us for opinions. And so generally we have them, which is, I think, helpful when it comes to a podcast or comes to, anything going on in the community. We're definitely community members, community driven. Surgeons tend to be very mission driven, like whatever the mission is of their hospital or what they're trying to do. Could be a private, organization. But I think that is something that Columbia taught us too. I think at Columbia, most of the physicians that trained us were very unique and very driven in a way that was not just their personal success, but they really wanted to teach us that we should be taking care of the community. And coming from this West Coast, there wasn't as much of that at USC. I loved going to USC, but I was not very, I would say, visible to the community there. And then in New York, you just felt more a part of something. And in Michigan, that was the case too. I think you'll agree. Like it just was sort of more hometown, smaller, understanding what we're trying to do. So then when I hit Phoenix, I thought, okay, I don't know what kind of impact I'll have here, but it turns out that you can really have a very big impact because it's a very small, it's a very young town, which is weird. But like you're in New Jersey, I'm in Arizona, where we've only been a state since 1912. So,
Right.
and Phoenix Children's has only been an organization for 40 years. We just had our 40th anniversary. Columbia is like 250 years old, right? And so I think that's what I was used to, just this like steep, tradition, like a deep, steep tradition. And in Phoenix, there isn't that. So you can build whatever you want. And if the mission is to really take care of the community, it can be starting from scratch. That's what we do.
Yeah,
So that,
I want to get into that for sure
yeah,
because your growth, I mean, obviously Phoenix is a place where the growth has been explosive, and you're now associate surgeon in chief for Phoenix Children's East Valley. And so I want to get into that and see what it's like to be in a place that's so crazy new, like you said, and also growing though, like expanding, like so you're basically creating a lot of traditions that maybe we had always had both at Columbia and in Michigan. But what is it that you took away, say, like remember something for me either from Michigan or Columbia that really sort of that formed your or guided you as a surgeon or as a young
sure.
surgeon or someone thinking about surgery at the time that you were like, okay, this really kind of put me on that path?
Yeah, I would say I was always looking for something that was supportive. And so there were a couple experiences that were huge for me. I did a sub-I. You remember the sub-Is at Columbia? They were like, you could just be a sub-I with one person.
Yeah.
And so for a month, I was with Roman Noegrad, who
Oh, no
was
way. The vascular guy.
a
Yeah.
vascular surgeon. That guy, like for a month, I was like his like gal Friday. I will kind of call it that because it didn't seem like you were his student. He treated his sub-Is with so much respect. He would let you do all kinds of cool things and then really got you. I mean, you were with him every second of his day. So all of clinic, all of OR, and watching him interact with the chief residents and just showing everybody a ton of respect. And I talked to him about it. He had daughters. He only had daughters. And he mentioned, because I said something to him about, wow, your interactions with people are so great, especially it just feels so supportive. You're supporting women surgeons, female surgeons. And he talked about his daughters a lot. And I remember very clearly, like, they're the people that train me that have daughters. treat me differently than the people who train me who don't.
Us.
And that I remember it really, really clearly in medical school. And then I remember it very clearly in at Michigan. It was the
Mhm,
same way. If somebody had daughters, if one of the surgeons had daughters, they really got it. They understood not only who you are and how they could train you differently. And they did. I think they train women and men surgeons, differently. Just they kind of lean into whatever your particular skills are
mhm.
and just like help you develop those. And I felt it there. I remember talking to them about it. Dr. Arnie Corin, who
Right.
is a like a famous pediatric surgeon who trained me, his daughter was probably a couple weeks difference in age of me. And
Mm,
you could feel that he was training me as if I was his trainee and like a daughter. And he
mhm,
mentioned it many times to all of the trainees. He treated us like we were his own kids. And that
mhm.
sounds kind of weird because like you're not a kid by the time you hit residency, you're in your 20s. But you could feel how important it was to them to treat you with that kind of respect, that real true sense of I want this person to succeed just as if they were my kid. I want everything for them. I want them to be bigger than me. And that's how we are, right? With our kids, like we want them to succeed like more than us, but also learn from anything mistakes we made. And these surgeons were like that. And I took that away, both those experiences for sure.
Roman Novigrad was a legend at Columbia, and there are so many anecdotes, so many people who remember him so well, and I think you're right. The one thing I remember about him was he spent every waking moment in the hospital. If you needed a vascular consult, he was always there. Like, you could pretty much always get him. He kinda had a bum leg from a motorcycle accident, but he was always walking everywhere. Like, he was, like, kinda
Yeah.
gimping around and doing any case that anyone had, like, wanted to tee up, no matter it was what it was, he would take that case on, and, he was legendary for it. And
Yeah.
I think, um, Dr. Corin is a legend in the pediatric surgery community for sure. Um, and I think that a lot of these mentors kept us as family members, like, we were family to them. I mean, these
Mhm.
are people who spent immense amount of time in the hospital, in the operating room. And like you said, it was kind of an apprenticeship, mentorship, family. Like, we got to know them so well because that's really what their life was about. They were dedicated to their career, to teaching. These were all highly academic surgeons. Like, they didn't want to just do surgery. They wanted to pass on that craft and what they knew, and more importantly, how they did things properly to us as mentors. And as mentees. And I think that was really, really important. And so do you take that now when you have younger surgeons, when you have other people around you? Like, what do you do to sort of pass that along, or,
Yeah.
keep that in mind?
I mean, I let him in. I let him into the details of my life, how it works. Like, how do I handle, raising kids? I have 3 kids, 2 daughters and 1 non-binary daughter. And
Mhm,
it is a very interesting. I'm also single. I was ended up being divorced like now 12 years ago.
mhm,
And I have a significant other, Jason, who lives up the street from me. We're 8 houses apart. So he has a boy house
mhm.
and I have a girl house, which is like really unique. When people find out that, they're like, wow, that seems like that would work. I'm like, yeah, it does. um, you know, um, I think people need to know how you manage your home life too, how you raise strong daughters. Again, learning from not necessarily other women how they raise their daughters, but I learned from other men how they raise their daughters, which I think is kind of a unique thing. I'm kind of like a mom and a dad in a way. But I do let people in when I'm training people now. I think the reason why I succeed here in Arizona and why people seek me out is they see me as a surrogate parent in the OR for their child. So I think of everything they need to know. I'm listening to their brains and all their questions that they don't know they have, right? So if I'm telling someone about surgery, I make sure I'm telling them everything that I think they would need to know if I was the parent, including how much time off they're going to need, like how they're going to have to arrange that, recovery. And they know when their kid is asleep that I am serving as the surrogate parent. And I'm making sure that in the OR, we're all showing this great respect to this sleeping child while we're operating on them. And that we all have a lot of respect for each other, which we do. In our OR, it's fun and it's respectful. And we just never, there's no snapping, shouting, nothing like that. And so that kind of environment leads to really good outcomes. You're just kind of making sure that everything is smooth. That's what I've been told. Like all my moves are, intentional and smooth. They're efficient. There's not extra stuff. Um, like one of the things that I know that you think about too is like, what other distractions do you have in the OR? And we do play music in the OR. I feel like music does, kind of speed you up sometimes, like, it keeps the rhythm going instead of just, like, silence, but it still has to be, I would say, pretty respectful music, right? I know some people might choose things that are a little, off color or whatever. That's not gonna happen in a pediatric OR usually. Um, but also, I have kicked people out of my OR when they come in and they're kinda negative. And, sometimes I don't kick them out in a mean way, but I'll say, "Why don't you go grab a cup of coffee in the doctor's lounge?" Or I'll tell somebody, "Why don't you go see if there's anybody you can round on because we have a super positive, attitude in here." And I'll say something like that. It's not very often that I have to do that, but I think when I'm training people, I do let them in. Everybody, right? So like you said, it's family. Everybody in the OR knows. They'll ask you like, "How are the girls?" Like they'll ask you if you're going on vacation or you're going somewhere. And we all are kind of learning from each other because maybe if you had like a more normal life, you would have friends and you would like all my friends are kind of the people at work, right? So if I'm going to go on vacation, for example, and it's somewhere I've never been, I'm gonna ask anyone in the OR who's been there for recommendations. We're kind of talking about, oh, where did you stay? What did you do? Also schools, like, applying to colleges, like what kind of cars for your kids, like vehicles. It's all done at work, which is kind of interesting, right? Like probably other industries, there's not as much of that. Maybe there is, I don't know. But everything we do is so intimate and so, like, everybody's wearing the same clothes. We're all in scrubs. We're, you know, taking care of someone's body. It's just all really kind of interesting, I think, how different it is. But yeah, I think the main thing I learned from my mentors is just how to be a real person to my mentees so that, you're not just like up on a shelf. So I like that part.
It really resonates with me, the things you talk about. Well, first of all, the group that you are with, you are trusting there's an immense amount of trust and responsibility in the operating room for everybody, right? And like you said, it's a team and everyone is very close. And so it's natural that you would share your family life, where you're going on vacation, all those, what's going on with your kids with them because these are the people that you are around all the time. And that was always the way it was when we were training too. We knew everyone in the operating room. We different surgeons had different cultures or environments, but I knew everyone really well. I mean, we were residents, we basically lived there, so that was sort of a natural extension of where you are now with it. Um, I also think it resonates with me a lot about no wasted motion, efficiency.
Yeah.
I think the best surgeons make it look easy because
Mhm.
there are no wasted movements with anything. Everything is it looks simple, but to get to that simplicity takes practice, experience, a lot of work. It's when you start and everything, you do it at first, and it's very unsimple at that point that you have to learn
Right.
how to keep it simple. Like you said, set everything up so everything just works for you.
I think you
Um,
can teach that for sure. So the fellows, so we were pediatric surgery fellows, right? And we have
yeah,
also general surgery residents. But teaching them this extra moves that they don't need, the way I'll say it is, okay, that extra thing you just did, whatever it was, sometimes it's part of the prep, right? So like they'll give us these little IO band strips to put the towels down. I'm like,
right.
well, you also have stickers on the drape, so you don't really need the IO band. And some I don't want to say never, but like in general, I tell them, like, that amount of time you just took to put the IO band on, multiply that by, 500, 800 cases a year. How many years are you gonna be in practice? First of all. the cost of it, you can just forget, like, you don't need that. So, but the time of your like, you're getting back all this time, let's do the math, of your life. So just don't do stuff you don't need to do because you're gonna save all this time. Like, it's really, I think, important to learn, but they
What
can
is
take
one
it
of
or
your
leave it.
what is one of your favorite surgical procedures now that you really love to do?
So I do reconstructive surgery mostly now, and it is because I run the Differences of Sex Development program here at
Mhm.
Phoenix
Mm,
Children's, which is
mhm.
that's also my areas of research is like, kids born with a mix up between their chromosomes and their anatomy. So you might have a girl with XX chromosomes and she's born with more, male appearing parts, or, might have something the opposite of that. And we do a lot less procedures on infants now, as you probably know. There's like, you don't want to maybe fix things as an infant. And so we do just a lot of medically necessary procedures when they're babies. But then later, these kids will want reconstructions or need reconstruction. So I do a lot of teenage reconstruction. So, and, throughout their lives, but those are big cases and they're combo cases. So they're with urology and the fellows, and there's always a bunch of people in the room when we're reconstructing somebody. We like those cases because you're making a big difference for someone, making their lives better because they can, pee and poop better, which is the basics that we all want to be able to do. So those are probably my favorite cases. Some of the ones that I initially did here in Arizona were a lot of scope cases. So, like thoracoscopic repair of a diaphragmatic hernia,
Mm.
thoracoscopic lung lesions, taking out pieces of lung with cameras. And on babies, that is no easy surgery. And so I did a lot of those initially here. And then at some point, I was like, the younger people can do some of these more like stressful cases. I'm going to do, not that reconstructing someone's bottom isn't stressful, but there's something to be said about kind of limiting the life-threatening surgeries that you do. So at this point, I do very much less trauma, less cancer. Cancer in kids just is heartbreaking to me. I just can barely handle it. Families still will seek me out, some of the cancer families, because they think I'm like a good luck charm or that I have like some sort of like pixie dust. I'm kind of known for like pixie dust. So you can kind of like sprinkle something on a kid and it just is this extra added level of like improving their outcome. And that's kind of weird. But like we started the ovarian preservation program here with the cancer folks. So girls who are going to undergo like gonadotoxic therapy will take their ovary out, store it, right? And
Mhm.
I, of course, was one of the people that helped start that. But that to them, like these families, you're just taking an ovary out. It's like not that big of a deal. But to them, the fact that I do it, it makes it somehow more hopeful. Like, because I'm hopeful and they can tell. They like, I see that kid's future and they know I see it and they want their doctor to see their kid's future. And so that's probably what I provide that is different. But yeah, it's a weird job. I have a weird job compared to some surgeons. I think all these things come into play.
Mhm.
You know.
It sounds funny because I think when we're younger, we are kind of adrenaline junkies. We wanna do all the cases. We wanna do everything, the most complex stuff, the most challenging stuff, the most difficult stuff, and then I don't know what it is as we get older, but we get a little pickier and choosier about exactly what we want. Do you think it's, yeah, what do you think that is? Why do you think that is?
Well, you know that when you have any kind of outcome, even if it's like minimally bad, like it's just not, not that someone passed away or anything, but you really perseverate over it. And we all
Mm,
learn to do that in residency because it's in our hands. Like all of that service that we're taking care of for those attendings, it's in our hands to have a good outcome and we feel it. And every little detail, if it doesn't go right, you can perseverate. And so I think as you get older, there's just so many other things competing for your time. When your kids are little, there's something easy about just like every little kid. It's easy to take care of them. It as they get older, these kids are very unique. Each of your kids needs your time in different ways. I feel like I had to buy some time back from my job to give to
mm,
my kids.
mhm,
And doing really stressful surgery, it's a big part of your brain,
mm,
while that kid is recovering. even if it's so on the reconstructions while they're recovering, I'm, you know, making sure they're coming back to see me a lot, making sure they're healing okay. It's just very time consuming. So I think we have to buy back our that little part of our brain that's like storing all that stress so that there's room for other people. Plus, like think about the people you met when you were first out of your early attending and you meet people who are much older than you. Like maybe they're your partners, maybe they're at the hospital and they're 20, 25 years older than you. And they either seemed really great or they seemed super stressed and burnt out.
Yeah.
And right. And I
Yeah.
met some of them and I was like doing the math. I'm like, okay, this person is so stressed out and they are 20 years older than me. So that means I need to retire in 20 years. Like I'm going to have to retire in 20 years because like I won't be able to, I don't want to be like that. And instead of retiring, because now it's 20 years, instead of retiring, I just think you have to anticipate like, how am I not going to be burnt out? Right. I don't want to be like that. And one of the ways was reducing the stressful surgeries for me. And the
That-
other was reducing time in general and just starting to
mhm.
build programs that let me be out of the OR, to be honest.
Right. Right. Now, as you get more senior, do you still, well, first of all, do you still take call like at any of the places that you're at?
I do, yeah. So I don't take overnight trauma call at Phoenix Children's, which is like a very, very busy hospital.
Mhm.
I take the call that is servicing all of our neonatal ICUs in town. And
Okay.
then when our new hospitals, Phoenix Children's is opening 2 hospitals this year, like full hospitals with 24/7 ERs, and that's gonna be important. So, we're in Central Phoenix, Phoenix Children's is, and there'll be a new hospital in the East Valley and a new hospital in the West Valley, and I'm in charge of, like, both of them, just, like, organizing all the clinical services, so I'll take call there as well. Those hospitals won't have, as many high acuity things, and so it's a little bit more of a bread and butter call. But yeah, being on call is fun because, like, I think I trained my brain a long time ago. Any consult is just a cry for help. I wouldn't call it a cry for help. You know what I mean? Any consult, someone is just asking for your help, no matter what it is. So you can't, you have to provide that help. You can't be annoyed. Like if you're annoyed, like it's not helpful. So we teach the residents too, like you should never ask, like, is this a consult or is it a curbside or is it a consult? Well, they called you. So it's a consult and they want your help. So go help them. So
That, that,
at the outside hospitals, that's a lot easier. At the main hospital, when everything's going crazy, you know, it's a little harder. So I changed the call I took and that helps my brain too.
that's really good advice. I probably should have listened to something like that more when I first started taking call a long time ago. It would have helped me probably. So you now have picked up a lot of administrative responsibilities, leadership responsibilities. As a surgeon, they don't really teach you in training how to be a leader. You kind of watch people managing people sort of, but no one actually says, "Hey, these are leadership principles. This is what you're supposed to do."
Right.
And now you're doing a ton of that. So how
Yeah.
did you learn those skills as just a surgeon? Because, we're just
Yeah.
expected to operate most of the time.
Yeah. That's a great question. So, I mean, you can learn them. A little bit of it is just innate to you and your background, right? So one of my things in my background is producing. I did a lot in high school, college, medical school, and residency, like producing events, as if I was like, Kathleen Kennedy and George Lucas. Like I think in another life I would have been a movie producer. But the idea is that you have a team of people. You are assembling that team. You're almost like casting them, right? This is like at Columbia, I was in charge of the drama club. And so we produced shows. We had a musical we did, Kiss Me Kate, where I cast some of the most unlikely people. Remember Sean Biddick and Glenn
Oh,
Gimrick
yeah.
in these
Yes.
like right? In these awesome roles where they stole a show in Kiss Me Kate. And it was just like they both said, we've never acted before. I said, no, it doesn't matter. Like you guys are gonna just literally you're gonna kill it. It's gonna be amazing.
Well,
But
they were
it's this
huge, like,
yes.
rugby players, so that's awesome that you got them involved in something like that.
Right, and they had so much fun, and they thanked me. And they said it was one of the most fun things they did in medical school. But this idea that you're just casting the right people. So it's just an idea of inclusivity. So, first of all, making sure that the right people, the right stakeholders are included in something as you build it. And then not micromanaging everything, letting people really shine and letting, like, understanding what their skills are and letting them help you do it. And those things I think were just innate to my background. But then I did do an entire year of coaching that I sought out. And that was really helpful to understand what's an executive level move. Like, you're, as a surgeon, you're willing to, like you said, be working constantly. You'll do all of it. You'll do every step of building something because you're just so ready to, like, meet that deadline and do more and more and more work. And so more executive level, activities are like letting other people do it and also expecting that they'll do it, like that you won't, come to the rescue if they don't get it done. So I think
Mm.
learning those things. Someone just sent me a great compliment, which was a book that they read that they said reminded this person of me, and it's called the Multipliers, and it's about some leaders are really trying to make everyone around them smarter and literally allowing them to do things so to show their full potential. And other leaders are more reducing people so that they can retain power. And he said, "You have always been a multiplier and you are for so many people. So
Mm.
thank you." And I started listening to the book, and it's just such a compliment because I love that. I even study teams. I study multidisciplinary teams that we created here for spina bifida, for diaphragmatic hernia. Just the idea of, like, let's actually study a team and how it works, because then we can make it even better. But I think the key to all of, like, executive work is inclusivity. You've got to bring everybody in to the table and making sure that they are heard. And then the thing takes off because it's not you building it. It's like the team builds it and then it literally just takes off. One thing that I think is a key for all leaders is look around for the gaps, like what is not being provided. And when you build something to provide that service, that's a full value add, right? Like, it was not being provided at all. And then you created something, you're going to get all of the business. So we created something here for the babies as they come out of the NICUs. They're supposed to have a neonatal follow-up clinic. And it's like required in a way by, national guidelines, but we didn't have one. And we opened it mid COVID, by the way. And now we service like 2,000 families a year. So it's just like the value add to the organization when you built something that didn't even exist and letting my team fully run it. Like, all I did was basically launch it. So that kind of stuff has been really cool. And like you said, learning to be a surgeon leader is is a challenge because you're willing to really just be the lead and you've got to just be a team member. The other
Mm.
problem is a gender problem. There is a gender problem still in surgery, and there is still in leadership. So this idea that not 100% of the people I work with are going to listen to me. There's a small percentage that are just like, I'd rather, I'd rather she look different, like I would want her to look like more gray hair, more authoritative, more, cut and dry, not as cheerleadery. I'm very like the cheerleader. So I think that what I've learned there is I just partner with men in my teams that sometimes I have to say, why don't you go try to get this part done? And I know that sounds almost defeatist, but it is the way that I learned to handle it so I can still get the programs, launched. But Arizona still has a little bit of that. Maybe there are some places it's not as common, but I think we
No,
do have.
New Jersey's got it too.
Yeah.
Like it's still everywhere. I
Yeah.
think, and that's such interesting. That's an interesting approach, and I really, it's a very practical approach about getting things done. And I wonder in 10 or 15 years whether that will be the way our kids get things done. I feel
Or
like,
if it'll change, like the
yeah,
numbers will change. Yeah, I think so. So the applicants to pediatric surgery this year,
yeah.
75% of the applicants are female.
Wow, that's
It's
so different than when we applied. It was like,
mhm,
how many women applied your year? Like, very few. It was so grueling
very
and
few. Yeah,
it
and
was
so
brutal.
it was in the pediatric surgery, the main, pediatric surgery association is called APSA, American
Yeah,
Pediatric Surgery Association,
yeah.
and APSA has only had, 5 female presidents out of 55, and the first program chair to be female was me. Like 2 years ago, I was the first program chair ever that was female. So the program chair is in charge of like what we're thinking about in the national meeting. Like it's a big deal. It's a big job. And I wanted to be on the committee. And so I applied to be on the committee. And then I get this email, congratulations, you're on the committee. In fact, you're the vice chair. I'm like, how did I get to be the vice chair? Like I wasn't even on the committee yet. And then one of my colleagues is like, you understand that if you're vice chair, that means you're going to be the chair later. And I was like, "Oh, that seems cool." And then when I found out what the job was, I was like, "Wow, I understand why I got this job because it's a lot of work and I'm gonna get it all done." Um, but the person who gave me that job was Ron Herschel, who is
Oh, yeah.
an yep, pediatric surgeon, at Michigan, who was the president of the organization at that time. And I've talked to Ron about it. I was like, "Ron, that was such a big deal that you basically accelerated my path to be the program chair. Like, we should tell people that you did that or that, you noticed that there were no females that had ever taken that role or ever been given the chance." And he said, "Kathy, it's partly that, but it's mostly because you're a closer. Like, I needed a closer." Okay, I understand. And I can get
I
stuff done.
I mean, I remember at Michigan when you were there, like, we were co-residents on trauma burn, and you had those leadership qualities, the things you mentioned that have sort of driven what you're doing now. You were a cheerleader. You brought everyone together. You were super positive. I remember we were third year residents and the twos and the interns loved you. It was like a really close knit team and you brought a lot of positivity to a place that was very depressing and had a it
Yeah.
was a tremendous amount of work and yet you were able to bring people together. They worked so well as a team and it wasn't and you were a cheerleader, but a cheerleader in the best sense. Like you brought the best out of everyone at every level. So whatever they could contribute as a first year, as a second year, you know, even just sort of attacking every issue, every problem, everything that came in, like, you were indefatigable. Like, you couldn't be stopped. Everything always was super positive for you, and that's unique. So I think a lot of your success, uh, yes, there is a lot that other people can learn, but some of it is very, very intrinsic to who you've always been, I think.
I think so. It pays off now. I mean, I still know those trainees. When they come through, there might be applying for a job here or division chief jobs. I mean, I want them all to succeed just as much as I did when they were our interns.
Mm,
The other thing about a team approach, though, is then it's less lonely for you. Like
mhm,
your own like isolation,
mm,
taking care of a patient or making something succeed
mhm,
it is less hard when it's a team. And so some of the hardest stuff I do here is really like these tough cases, these babies born with differences of sex development or cloacas, baby born with cloacas, where all their holes are mashed up into one hole.
mhm,
Those are hard cases over time. They're hard surgeries. They're hard to take care of the families. So as a team, it's way easier. Like I
mm,
remember taking care of these patients by myself when I first got here.
mhm,
It's like, oh, we're
mhm,
going to need a cloaca team. We're going to need a DSD
mhm.
team because it's just is so much easier. Not everybody is a good team player, right?
Right. I mean, and I think you've identified how you work and try to overcome those issues, which I think is also important that you realize
Yeah.
it's not always sunshine and rainbows for everything that you do and that but you still haven't lost that intrinsic sort of positivity in terms of building and growing. Let me ask you this. You're sort of at the forefront of what is a pretty political or politicized part of medicine these days? Gender, right? So, how do you deal with that sort of stuff? Or
Um,
do you at all? Do you avoid it? Is that something that you wanna deal with? Because like,
I avoid it. If
gender
you
care?
Yeah, in general, it can be avoided because the kids who are born with a congenital problem, they're protected under most state laws, even in in the states that are a lot more conservative. I'll give you an example. I want to say it's Ohio, just passed some legislation that was not supportive of gender related care. But within that legislation, kids with congenital differences are protected in that they can still get whatever they need, which
Mm,
the hospital systems they do work with the legislatures in many cases. And the legislature, when they're doing something regarding children's health care, will check with the legal systems around them in in hospitals. And so they had to do that because you can't ban things that especially are medically necessary. It's not
mm,
gonna make any sense, right? If a kid has a risk of having a cancer in one of their gonads, you're probably gonna need to deal with that. You can't ban it. And so that part has been okay to kind of avoid it. I think what we do instead of worrying about what the legislature says or what, states or federal people say is we just make sure that when kids are in front of us, they understand we're taking care of them and that it doesn't matter. We're legally taking care of them what they need. And they understand that. Um, I think nationally though, I don't talk a ton. Like you don't see me on a lot of, national shows kind of talking about what we do. What we do is extremely reasonable. Like Phoenix Children's has an amazing approach of just like, if you need something that's medically necessary, you get it. If you don't, we make sure that you understand everything using shared decision making tools, which we've studied. So I'm kind of considered Switzerland in a way. Like
mm,
the people who are political or the advocacy organizations that are stressed about surgery, they see me as like a neutral party,
mm,
which is great. So you can kind of be everything to everyone. You just kind of we put the patient first.
mhm,
Their body self-image, their how they feel about themselves, their
mm,
family connections are super
mm,
important. Like identifying that if your parents love you and want the best for you, your outcome will be great. That
mm,
it doesn't matter what we do to you. The surgery doesn't matter. What
mm,
matters is how much does your family support and love you.
mm,
And if they don't, which some families don't, then those kids, unfortunately, they have to grow up and they take care of themselves.
mm,
And that's when, they can change who they are or how they feel. The other thing I'll
mm,
say about gender is that
mm,
we both know it's just something of who you are, right? You
mm,
cannot tell somebody what gender to be. So since I have three daughters, but my oldest is non-binary, like I've learned, and that's my oldest. So I've learned a ton from River as River's grown up. River's now 22 years old. But this is a child that did not wanna wear, girly bathing suits from day one. I mean, I wouldn't necessarily put them in, like, bikinis as babies, right? Because that's so
mhm,
silly. But I did at least you would pick out bathing suits that were, from the girls section until River got old enough to let me know that that's not what they really wanted. So now we go to Target, this was when they were little. We would go to Target and we'd pick out girl bathing suits for Zoe and sort of boy bathing suits for River. And I would just let them pick out what made them feel comfortable.
mm,
And it's a real lesson in your own house that then you kind of take to work with you. It's like kids just are who they are, but they
mhm,
really can't shine until you just let them act like who they are. And once they do, they just don't make a big deal about it either. Like they're
mm,
just, when it was time for River to go to prom, they wanted to take their girlfriend and we went into
mm,
Nordstrom and we bought a suit. And the suit is
mhm,
gorgeous, like this
mm,
gorgeous, like navy blue,
mm,
Ted Baker suit that
mm,
we went into the men's section and had it altered. And it was just a great experience. So sometimes it's just understanding, just letting somebody be who they are. Like you and me, like we get to be who we are. I get to
right,
shine because of who I am. Like how great that is, right? Like you
right,
said, it's just my personality lends itself to some of the success I've had. So you would obviously want that for, again, your own kids and your own patients. And if you
mm,
see your patients like your kids, which in Pete surgery is so easy to do, it's just about thriving, right? What does it take
right,
to thrive? And I mean, we have to think about that for ourselves, right? Just like
Mm.
the two of us and all the people our age. What does it take to thrive in our next 10 years? Our
Mm.
last 10 years?
Well, that's what I was going to ask you about was so we've seen our mentors, and some of them have sort of finished off their careers maybe gracefully, and then some were like draft horses, which they just kept going until they literally couldn't do what they did anymore and dropped dead in their like harness or whatever.
Right.
So what is your plan in terms of like what you're going to be doing in the future eventually? Because we all have to stop working eventually.
We do. I think you gotta just take care of your family. So I'm kind of an orphan, which is weird. So my parents died I would say pretty young. I was 30 and 43 when my
Mm.
parents died. And I don't, my oldest brother also passed away, and my middle brother is kind of estranged. And my dad was from Holland. So I don't like, there's nobody in the US. So I kind of am, obsessed with my daughters, as you've heard, and also
Mm.
plan on helping them take care of their families when they start to grow their own families. Like I will be across the street. Like, what do you need? And
Mhm.
so that's how my mom was before she passed away. She helped me with my kids. And so I really want to be this awesome grandma. I mean, my vibe right now, I call it like cool mom vibe. So it's going to have to go to like cool grandma vibe. And then, so that's probably my future. I think there is a role for continuing to support women surgeons like in pediatric surgery because I'm I'm kinda known in those circles too. When the fellows come through, they're like, "Oh, you're famous. Like, you're famous, right?" And I say, "Well, that's very flattering, but, like, I don't know what I'm famous for other than these things, like, right, being super supportive." So, I feel like that will be a future too. I think what you should do is you should see what you're really good at and what the hospital is, like, so needing you to continue to do, and you need to identify somebody else who can do it and train them and get them to where it's sustainable. So the sustainability of the cool programs I built here, fetal care, DSD, spina bifida, CDH, the new hospitals. It's easy if you can find somebody as passionate as you and as mission driven as you to like take it over, mentor them, and then hand it over. And then I think you just say, it's still all the babies are still thriving. All the programs are growing up just like your own kids, and then you retire and you say, "Thank you, everybody, for continuing my work." But it's such a blessing to have that in Arizona, to be at such a young hospital where I got to build something that I can continue, you know? Same thing with my work in DSD, and just like it's sustainable. It's
Mm.
the last part for me here is equity. So health equity for people in Arizona who are Hispanic and Native American, and making sure that whatever I'm providing for all the other families, that those families are getting the same thing. So
Mhm.
we're studying that really hard right now, and just making sure that we're figuring out how to provide it. So there's one Native American community south of Phoenix that we're just going to go provide the services there for this baby follow-up program, because they just, for a variety of reasons, have a hard time coming up to Phoenix to be in those clinics. So we're taking the clinics to them because that's what they asked us to do. And I think like my last part of my career will be like kind of stamping that, that not kidding around about health equity, but that's hard.
I
So
was
we'll
about
see.
to say, every time I've worked with hospitals, it's always been about the money, it's about funding. How do you manage that where you are in terms of dealing with providing healthcare? Like, these are not I mean, I would say a hospital administrator would be like, "That's great, but we're gonna just lose a ton of money if we do this."
So it's downstream revenue, which once you figure out like how to work with the finance people on like what does that clinic bring in, it just either has to pay for itself or be profitable. We're at a nonprofit hospital, so we don't have to make a ton of money on something, but it pay for itself or be profitable. If there's a slight loss to something, you just have to see if you can kind of recoup it in another way, or if it's just the right thing to do. The
Mm.
hospital has a mission, and so they'll understand, like, sometimes we gotta provide something that's just the right thing to do, as long as we
Mm.
can kinda sustain it.
Mm.
It is one of my jobs going forward nationally with these DSD, programs, is to teach people how to do it. So
Mm,
how much does it cost to hire an RN? What does
mm,
an RN coordinator cost, and how much is that over 5 years? And how many patients do you need to see in order to make that profitable? Um, the hospital administrators here have let me in on those secrets.
mm,
And I think teaching other people about that, reporting, you got to tell people when you're doing a job what the impact was. If someone's going to give you money, like a foundation donor is going to give you money for a program, you can tell them how many families they've touched,
mhm,
because of that donation. So these are all the things that, like, my part-time job is like raising money for the hospital. I am
mhm.
told by the foundation people that if I wanted to quit my job and just work as a fundraiser, that I would do really well. but,
That sounds
but
that I think that's one of the biggest parts of your success is that hat that you wear, you're probably really, really good at, which is what hospitals need, especially from surgeons who don't necessarily have that skill set. I would say most of them actually don't.
yeah, well, you got to be able to tell a story to someone and then show
Mm,
them the impact of their dollars. And it's
mm.
inspiring.
I think that that's something that as a young anyone, like, knowing that those hats are hats that are really important for you to wear, no matter what your job is, be it a surgeon, be it in any other industry, like, you have to know that you're gonna need all these skills to really sort of go where you want to go, because these are places you wanted to go, things you wanted to do. But if you didn't have these skills, it would have been a lot harder to do. But I would
Well,
say
it's
that let me ask.
personality, right?
It
It's your
is.
personality. Yeah.
It is. And some people just have to maybe build up that part of their personality more than others. I think it's a learned skill to a certain degree, some of it. Not all of it, but some of it.
Yeah.
Um, what so you're operating less now. You see yourself not operating sooner, later, and when you do that, will you regret it? Is that something that you're, like, okay with, like, stepping back from the OR?
Yeah, I mean, even when I did, I will tell you, one of my partners, who I respect a lot, his name's Dave Notrika. He said this biggest tragedy ever was when Kathy Van Leeuwen stopped operating as much because you were the best surgeon here, and you know, it's just a tragedy. And I'm like, well, I mean, the thing is, I can take better care of patients because I'm not as exhausted as I was. So I was operating my fingers off when I got here, and the problem with complex patients is that they need an answer when something's going wrong. The team that I told you about, all these teams we built, sometimes they have to ask you for your expertise. You can't just be unavailable and tired and sleeping. And, the same thing for your family. You can't just be exhausted the next day. So I think I take better care of patients because I have more time. And so it's different. It's not operating as much, but it's operating on a higher level, like these complex reconstructions, just trying to teach people how to do it. I mean, from like moving tissue around, you have to kind of get a sense of what can and cannot be done. You have to do a lot of something in order to understand it. So when I'm teaching somebody how to do your general reconstruction, we can draw it on the whiteboard as many times as as you want, but they're not gonna get it until they see it. And that's what they say is like, "Oh man, I didn't even understand at all what you're talking about until I saw you, make that incision or move that tissue around." So all of that I couldn't have done, 10 years ago when I was just operating like crazy. I didn't have time. You can't go. There was one day I did 17 cases in a row.
Oh my
I had been
god.
up Yeah, I had been up all night and still operating the next day, which a lot of times that, it just happens if you're doing emergencies at night. But those 17 cases, you kind of think they have to be pretty simple stuff. Otherwise, with the amount of tiredness you have, you just can't do it. So now going into a case that's very complicated, but fully rested, which is what the families expect from us, right?
Mhm.
They don't want you post call and tired. They want you on your game. And I provide it. I just say I'm going to do that. And I'm careful about the schedule to make sure that I'm not tired. You're not flying in that day and you got a case that day. You're not flying out that night to go somewhere. So in case there's a complication, right? So it's a lot of work to be the kind of surgeon that you think you should be. But I'm I'm spending that time to do it. I still do very well financially, and it has to do with all the other work I do too, right? So one thing you can do tired is you can evaluate your program, where you can gather the numbers from your clinic. You don't have to there's things you can do that aren't somebody's life in your hands when you're tired. But when you're operating on somebody, you should be rested. So I'm not going to regret operating less. I think it's a really nice way to wrap up the career is not be, like you said, this like workhorse that's going till they're till they drop over. Um, and we both know of like, people who've done that. Or, we've all been around long enough to see people who lost their lives early. Dr. Teitelbaum at Michigan who had the brain tumor. You know,
Mhm.
I I went to visit him and I helped him write letters to his daughters because that's what my mom had done. She had written letters to my daughters. I'd asked him, "Do you want to dictate letters to your daughters while I'm here?" And he did. And it's so emotional, but it's so like listening to somebody talk about the people they love the most. And just this idea that he died, he was 56 years old, I'm 55. So you cannot just be in the operating room all the time later. You need to be enjoying your family and enjoying like your life. You need to be traveling. We went to Yosemite in last fall, my youngest and I. And of course, I'm completely blown away. I think I've been waiting my whole life to go to Yosemite.
It's
Like,
literally like in
why?
your backyard.
I know, why does it take you this long? So, we went hiking and I watched Free Solo while I was there about Alex Honnold, the guy. Like, I was terrified. I was like, what is this guy doing? I mean, I know by the end of Free Solo, he's alive because it's about him and his like how he did it. But this idea of just like you have to get outside, you have to lead your life and travel and enjoy things. And it just can't. There are people who will argue, well, but you're at your best. You operated so much, like you're so good at that age, 55 to 60, for example, that you should just be operating. Okay. But like I also want to go to Sweden, like where we want to, I want to do things, that are work related. We're going to Sweden on a meeting, but still like I want to go do things. So that's how I'm going to do
I
it.
that's I think every surgeon, that is the dilemma, and you're right. You are at the peak of your experience, your game, your skill set, your knowledge, and yet when we've seen our mentors, yeah, everyone approaches it differently in terms of what is meaningful for them in life, what matters. Uh, I think some of my mentors that I've seen would have felt exactly the way the other surgeons around you said. Like, we need you in the operating room doing as many cases as you possibly can while you are at your peak. And I don't think I mean, personally, I don't think that that's the healthiest way to approach it, but it really depends on what fulfills you. What fills your cup? Like, for some people, and I know that only being in the operating room is what makes them happy. Like, just being in flow state, sitting there and operating over and over and over and over again. Like, that is what they need for fulfillment, maybe to the exclusion of others, or a balanced life or what have you. I have to look at your life and say that's a pretty good blueprint actually for a lot of people. I would say if you're a young surgeon, sort of following along with sort of what you did would be a great way to look back at your career and say, this was a very, very impactful way because, like you said, you're impacting a lot of lives by setting up at a relatively young city, institutions, care network, and hopefully making an impact for years and decades or longer, hopefully, once those things have been set up. And we've seen that at other places like at Michigan, at Columbia, once they have traditions, once they set up, sort of traditions of excellence, that hopefully that impact will be made, especially, like you said, with younger people that you're training, others around you, starting out on your career. Um, Let me finish with this. Is there anything else that you feel is really important if you were to look back, or I don't know, our situation is different, but someone now, like if you had to give them something to take away, uh what would that be at this point?
I think probably just leaning into your emotional intelligence, like we've talked about a little bit on this
Mhm,
podcast, but the idea that being true and really exposing yourself to people, like allowing people to understand who you are and what motivates you is is a part of the game that is makes you super successful, but also
mhm,
super vulnerable. Like people who there's still people who are kind of, I wouldn't say they're out to get me, but they are not pleased, I would say, with my success and sometimes try to find, issues. Oh, she's too busy. She's too busy with her kids or something like
mhm,
that. I've had people
mhm,
say that, or like she's too into, her own, taking care of her own kids. It's like, well,
mhm.
that should be a huge feather in your cap, but it's for whatever reason, sometimes a detractor. So I would say that's the main thing. If I had to do surgery again, I would want to do it now. So I would want, if I had to do surgery again, I don't want to do it from 20 years ago when I was the first resident at University of Michigan to have a baby during their clinical years. So that's weird. Like to me, I want to do that now. I want to go back to Michigan and I want to be there now when there is a whole policy on allowing the residents to have babies and making sure that they're not doing a combined liver kidney transplant at 38 weeks pregnant, which was like,
Did you do
with
that?
John McGee. Yes, 38 weeks pregnant, combined liver kidney with John McGee on a Sunday. And I told John, we are not having this baby today. And he said, no, no, Kathy, no, absolutely not. We are not having this baby today. I 100% agree. And so he was on his best behavior and we got through that case. But it is, that's dangerous. I now know that like the complications that women surgeons have, we've studied this and written on it, is it's just impossible. Like the fact that we can get through these pregnancies with the kind of work we do is a miracle. And in a lot of cases it does work out. So for me it was fine, but still, is it fine? Like sometimes you kind of wonder what were the epigenetics of growing those babies, during my training and my first year out. But I think if I had to do it again, I want to go back and I want to do it now when there's more protection for families as they're growing their families. And it seems like there's more tolerance of just being yourself. And that 20 years ago I had to scrunch a lot of that down that I don't have to now. So but I thank you so much for inviting me to do this. And Sam, I think it's such a blessing that I've been able to stay in touch with you all this time. And I was thinking about Haft, and when you sent me
Yes.
that picture of us, John Haft, like, I'm very close with John still, and I think that we were in the battle together, which is why we all became so close. It was
Mm.
hard, right?
It was so hard, and I just remember how kind both you and John were. I was like, out of the tripod, I was the weak leg of the chair, because I was the plastics guy. I came from another institution. I wasn't, I was it and I just remember how positive, uplifting, kind, it was for such a difficult time. You remember the people who are lights, who shine, who, you know who are the superstars. You know who's going to be there and just do amazing things. And I always felt like watching you and Half, like, you guys, like, and Half too is just he was always positive. He always had so much enthusiasm, like way more positive than a future cardiothoracic guy should have, because everyone else always seems so dour and down. And you guys just brought a lot that
So he
was.
has he has emotional intelligence, even as crazy as John is. When my dad passed away and I came back, it was kind of sudden and I came back, he just hugged me and he was just sobbing. And,
Mm,
he'd only met my dad like once, but he just he understood like how hard that was for me. And
mm,
so what I'm saying is like we felt like with you and John and me, like we felt the same way about you, that this was a great team that took good care of patients because we also took good care of each other. And I think, making sure people could sleep, making sure people could eat. These are the basics. And I don't know, I remember it fondly. And even though I guess it takes 25 years to get over scarring events like that.
That's why it resonates with me when you said, "I wish I could do my training now," because there was so much back then that was so difficult, and especially women, it was, like, 10 times more difficult. Um, I remember just so many incidents that would blow people away now, like, "Really? Like, that's what they said to you?" Or, "This is what happened?" Or and so I think the best thing we could say is that it was people like you who were able to get through and affect change and then become people in positions where you could actually start changing the culture and making things different because um it was there was you're right. There's a lot of psychic scars that it took a while for us to sort of get over and we can look back at it now and laugh a little bit, but boy, it
Yeah.
was really the superstars that I saw then, and that's why I do this now is because I wanna go back and which reminds me, Haft has told me he would do it, but then he hasn't gotten back to me about it, so bug him and make
Oh, I'll
sure you
text
get him.
him. Yeah, I'll tell
Yeah,
him. Yeah.
and and, uh, and just to highlight the people that have a lot to bring to the table. Like, I think not just for, young surgeons or other people, but like, want my kids to hear stuff like this. I want other people who are just thinking about what is it that is important in life? What is it that, how do other people of quality do things? And maybe it's not exactly the way they'll do things, but it's a great different perspective for them to hear. And especially someone who, as we said, been through the trenches, seen a lot of really tough stuff, and you've come out on the other end
Yeah.
stellar. Like it didn't break you, it didn't beat you down, and even
Oh,
now, when
right.
you have people that are not, who are the naysayers or who aren't super positive, like you're still managing um, to do your best and to keep a really awesome attitude about that, which is really
Well,
that's inspiring.
one thing I'll say to close is that some of what we get to do on a daily basis is life changing. Like you will have an experience in training, but since then, that is actually life changing. That is so shocking and so dramatic that it's like watching a television show that it's like watching Grey's Anatomy. It's just
Mm,
like, it really is truly life changing. Some of these kids and how they handle these diagnoses, they inspire me, and I never get over it. Like it's never, I'm never jaded. I'm always a better person for having met some of these families and some of these kids. And, I come home and I share that with my own kids. So I'm super grateful. And I would say, yeah, the gratitude of meeting people like you and uh, just remaining friends and then having these families affect me. I'm grateful. And I just feel like, I mean, my mom, who is again passed away, but up in heavens for sure, she thinks everything that I do is just because it was supposed to happen, that families put themselves in my path and that I am like, oh, I got to take care of you because here you are. And there's a reason. And, whether you believe in faith or fate, they're the same, which is you should be doing, impactful things. So, but thanks so much, Sam. This has been fun. It's been fun to think
thank
about
you.
it.
Thank you so much for spending the time, and I really appreciate it, Kathy.